In order to notify that, we are going to assign a CPT code called 9900, which is given for patients who are less than 1 year of age and who are more than 70 years of age. 99116, hypothermia. This is an induced hypothermia. Why are they going to induce a hypothermia? Here what happens is, sometimes the body temperature is also being depressed to 20 degrees Celsius. You know why this is being done? At this state, now the blood will not flow in a faster way. So that you can control the bleeding, which is a routine complication of any surgery. So the patient's blood vessels will not begin to flow freely, and so that you can arrest the complications of hemorrhage to some extent. So when the anesthesiologist or when the patient is being subject to a hypothermia, then you can very well report this plus code called 99116. Same way, when the blood pressure is being reduced, so we call that as induced hypotension. So here what happens is, the patient's systolic blood pressure is being reduced to 80 to 90 mmHg. Again, this will certainly have a control on the hemorrhage or the bleeding diathesis. Lastly, 140. Here imagine a patient is being suddenly brought to the hospital and the patient is unconscious and there are no proper history, but then you find a severe fracture or any particular major injury. So at that time, the physician or the surgeon will do the procedure, but now it is the anesthesiologist's call what is the type of anesthesia that should be determined. Here, the physician or the anesthesiologist is not aware of the patient's chronic or the comorbid conditions. So he will have to make a call and administer this anesthesia. So at that time, since it is an emergency and there is no preoperative evaluation and management by the anesthesia provider, so you can very well assign another code called 99140 to show that anesthesia is complicated by the emergency procedure, or anesthesia is being done as an emergency procedure.